Okay. Alright. So I need to not paint. Isn't there a new version of Paint now though? Do I need to update Paint? Paint 3D? No. No, I'll just stick with regular. I'll just stick with my regular Paint.net. That's never steered me wrong. Okay, where's my picture of Zubat? Oh, here it is. Okay, cool. Save. What do you mean it doesn't have an image? Really? Oh, because it's in that mode. Oh, what the hell am I trying to save? Oh, because I'm doing that. Okay, that makes sense. That makes sense now. Okay. Bam. Paint.net. Paste. Crop. And then magic select. Oh, Crypt, I think I see you in the chat right there. Let me get through editing this real quick. And I gotcha. Oh, I don't like how it's cutting off that part. I wish that was left as normal. Maybe I can change my tolerances. That almost works. That's gonna leave a little bit too much darkening there. That might work. That'll work enough. Okay, cool. I know, that's pretty, yeah, that's good enough. Alright, save as, PNG, Zubat, save this on the desktop, get that going, and what did you say in chat? You won't believe this, but the stream I was just watching crashed, and I just happened to see your stream. That is super crazy. It's funny because, like you mentioned before, it's like, oh, the other stream ended, and then you went up, so that's cool. So, very, very, very neat. How's your day been so far? Right? How have you been in the last 24 hours since I last talked to y'all? Fate is real. Anyways, how you doing? It's been a good day so far. We had a for work and everything like that. We have a specific meeting that we do 2 times a year, and it's a neat one because, hey, Cora, you're part of that group too. Anyways, is there a lot of people bringing in patients tomorrow? Let me check the schedule. There'll be some people, but it's gonna be more like sealants. There may be like one person bringing in like a polishing patient, another person polishing, but the rest are gonna be like each other. Everyone's using each other as sealant patients. So it's what it is. It's not too busy, but it's pretty much however I let them go and operate and do their stuff. But like I was telling you, Bite was like there's usually like 2 times a year that we end up having like this big meeting where we reach out to dentists and registered dental assistants and the dental community, and we say, hey, all of y'all come to this meeting, and we want to talk to you, and then you can let us know how you want things changed in the school system. And it's usually pretty neat. There's not really anything to say, nothing really to change. But it's neat seeing like all the docs come in and everything. I really want to get feedback. Like, let's see. Hold on. I was just wondering if there's space for me to do X-rays. Yeah, there should be space. I'll make space. I really want feedback, like to be be strict because I'm doing good, but I have some errors that I want to fix. Yeah, yeah. If you want to have, if you want to be like, if you want to be like insurance scrutinized on your X-rays, I can throw that filter on, and really dig deep into. No, you're missing that. That won't get accepted and such. Doctors being more strict now and talking about how some insurances require strict rules. Yeah, hey, look what I was talking about. Yeah, I was just talking about that too. Yeah, yeah, we can go into insurance acceptability ranges of X-rays, and work on that. Hey, I heard someone's preguntas also. Amaya told me. Shoot, that fool's about to join the externship gang in a moment. I just want to keep improving. Yeah, you're doing good. You're doing good. Shoot, I mean, what? You're like 4 weeks into it. Hold on. You don't know who it is? Why would you think G is the one? Oh, so you don't know. Because I figured she got it from you guys. I figured she was getting this info, but apparently she's got like other group chats happening on her second phone outside of what you guys going on. Oops, what's the lore that's happening? Yeah, for what I know, it's G. Yeah, no, it's G. From what I heard. I knew I saw her posting weird shit on Instagram. Secret GC's hidden information, the plot thickens. Yeah, apparently G's been pregnant for a bit, too. So I was like, oh, well, look at her being all fancy. So she posted a picture of an ultrasound, but it didn't say it was hers. Oh, yeah, she's hella pregnant then. Oh, that's funny. But yeah, she just but Maya was like, oh yeah, she like kind of just figured it out, and I was like, oh okay. She's just gonna get pregnant. She said she wanted to get pregnant soon after extern. That's crazy. She didn't tell me. Um, yeah, it may have happened before extern even happened. From what I can calculate out, it's probably happened before extern. I'm not surprised. Too funny. Too funny. Really? I I guess. Good on her. She knows that she wants. She knows that she wants that. I don't want to say that early in life, but if she knows that she wants it, cool. She can do it. Can't relate. I'm away a few years. Yeah, do that. Get your hygiene license, then do that. That's probably what I would say. Get hygiene, get your hygienist status, then do that, and you will have such a smoother life doing it in that. Get your RDA EF2, then do that, and you'll have a decent smooth ride then. Can't relate just in general. Me already Aspen. Yeah, right. Yeah, I have that. Yeah, I'm gonna have that coming up again on. I'm gonna have that coming up again next week too. So that's gonna be exciting. Where the hell did I put my picture at? Oh, I have a photo for you. Oh shoot! You gonna send it in the baddies? In the baddies chat? I have my phone right next to me in case. Okay. I need to put this here. Bring up OBS, bring up this. Alright. I'll have Discord ready. Oh yeah, I was gonna say, yeah, you're coming in tomorrow, kind of like same-ish time or whatever. You know not to come like straight up in the morning because it's just gonna be boring lecture and everything like normal. Here it is. It came up. Shut the front door. It's that one too. You guys were at that one. Who is it? It's you and Denise? That's hilarious. That is too funny. Gotta get ready for when I apply so I know how to care. Dudes, that's the thing, remember, I told you about, I talked to you guys about chain dentistry and everything like that. It's different when you're in, when you're on that patient side and everything. Literally just put a good word in for me, please, right? I need a job. It would actually be pretty cool to have I'll be so sad and broke. It'll be cool to have an office full of previous students and everything like that. That would be pretty dope. I would say. I tell you what. Okay, I'm gonna throw the Zubat hidden in there. Going through that. Let me get a little bit of rotation. I'll be the lead DA. Trust. I would believe that because I ain't gonna do it. Why the Zubat? I like that you just came up with that with that crypt. You're like, I just gotta ask, why is there a Zubat on screen? What are you doing? Yes, you will. Are you doing tray setups? F that. I'm gonna be setting up stuff. I ain't gonna be trays. It's gonna be teeth on dentures. Make you clean rooms, dude. Yeah, you guys are. Yeah, I'm gonna be your guys' bitch in the office. So the reason why, Crit, I don't know what else to ask y'all, exchanging lore or something. So for this, usually when we get temporary crowns, this is the same video that I was editing yesterday. When we get temporary crowns and we're taking them off after they've been kind of just freshly made, they'll have these little protrusions sticking out, and I call them bat wings. And so I was like, I just might as well throw Zubat in there for some reason. Give you some terrible impressions. That's just effed up.
Using your nearby cord pack management, go ahead and take the ledges and just gently remove it from there, just as and then start.
I'm not as confused now. Oh, I have a. Okay, so I have a. I forgot that I had a close-up shot. So I'm going to mimic. Hold on now. Let me see. I want to copy, bring this back, look at Zubat, specific PNG, I'm going to match that to scale and position, and then, because it kind of like matches his ears or his wings, I don't know what the hell is going on about. It almost looks like Golbat. If I flipped it, if I rotated him a little bit more, probably it'd be like more like Golbat. Let me look at Golbat real quick. Golbat. Golbat does kind of have a little bit more of his arched-like wings. Let me try. Let me go and jack his thing. Golbat. Throw that to the desktop, and we'll have a bat off. Oh, he flew. Didn't he? Did he just yoink the whole tooth out? I can't lie. I enjoy listening to things without needing context because it's entertaining. It's the only time I can spill tea anymore since I'm not in school. Sorry, I just listen to random people conversate in high school. Yeah, definitely, and especially when it's in the office, it's it tracks the same way. Okay, so let me see. And then I can not maybe a little scale, rotate to the right a little bit, down. Okay, so and I'll paste the attributes of motion on these guys. Oh, they're too big. Hold on, wait a tick. I didn't change. Hold on. Why are you scaled up so that? Then I'll continue. Yeah, keep continuing, especially since you guys are freaking photobombing potential offices of employment. What the hell were you guys eating, apparently, that they're gonna have on camera out there? McDonald's, there's a McFlurry, like an iced tea, some fries. What the hell's blue? You guys are too much, I swear. You guys need to start working. It'd be a riot if you guys ended up working at the same place. Then continue. Any tea with Class BT dubs or any arguments with soups? I'm literally gonna act as like a patient McDonald's. Is there any tea brewing right now? Oh, are you gonna do a TikTok trend? Oh, and we're doing a TikTok trend where I can show you later about security footage. That'd be cool. That is gonna be hilarious. I have no clue what you guys have in mind, but that'd be fun.
And then start inspecting it to see all the different bat wings and things hanging off the side.
Okay, I might do gold bat. Let me take him off. Bring this back. Okay, so that's the end. Let's bring this over here so it properly sizes the correct way. Bring this over here. Let's make Golbat a little bit more, a little less opaque. I'll send you 1 second. Hold on. Us running back and forth, frothing rock, paper, scissors, scarfing down. What the fuck is going on? Also, are you, what do you say? What are your thoughts on Ogerpon? I need a quick Pokemon opinion. What the fuck is Ogerpon? Okay, for one, I know the first 150, or I guess 151, and then the second generation after that, or maybe that's called generation 1.5 or whatever. Past that, I have no clue. I know Feraligatr and whatever comes with Feraligatr's generation. Feraligatr, Chikorita, and no, that's not Feraligatr. That's his evolution. Totodile, Chikorita, and Cyndaquil. I have no clue about any other starters past that, so I'm gonna have to look up this Ogerpon. What the heck? Oh. Very humanoid? Is this gonna be coming up in a new gen? Oh, it's grass type. 9th gen? Hold on. Released in the Scarlet Violet DLC, the Teal Mask it has 4 forms: Teal Mask, Wellspring Mask, Heartspring Mask, and Cornerstone Mask. Neat. Oh, this is okay. So this is what this got going on. That's neat. And it's grass type. Very Zelda-esque. Yeah, very Majora's Mask-esque in a way. But usually I tend to dig the grass type and the water type starters for the most part. Never really got into too many fires. They were cool, but I usually would, if I was starting out, it would be Bulbasaur or Squirtle or Totodile / Chikorita. But usually I'd go more Totodile on that one. I personally like the Ogre Pawn as someone who doesn't really know much about Pokemon. Also, it has different master change type. Oh, the mask changes its type. Oh, that's tight. Oh, I guess that would make sense. I like the plushy ones that they made of it. That's pretty cool. Shiny unlock 6 Ivy. I was gonna say, like, is any of these parts its arm, or is just its big wing, its big like head wings, its arm? Oh no, I guess. Oh, I guess it's scarf attack. No, what the hell? I'm trying to figure out what is its arms. Is it doing like a Powerpuff Girl thing where its nubs are its arms and it can hold objects and do everything as normal, or does it hide underneath it? I'm putting too much thought into it. Neat. Uh, Neat concept though. It's like a robe type thing. Oh, I was about to, because I was about to reference Mimikyu, where that's a neat concept of Mimikyu's like lore and everything. I was like, oh, that's I could dig it. That's pretty cool.
To see all the different bat.
Okay. Let's put the position scale. Okay.
Start inspecting it to see all the different bat wings and things hanging off the sides that we do not need. One, such as an inner pocket.
There's definitely a lot of lore behind Orgapon as well. It's definitely the high point of the whole, and but it's definitely at the high point of that whole experience. Oh, okay. I would like to try and get more into kind of trying out the Pokemon series again, especially since I have my freaking my little handheld, so just make it easier for me to take it more on the go. I wanted to do Let's Go Eevee or Let's Go Pikachu on my ROG Ally, and I think I tried to emulate and get it running, but it wasn't on the right emulator that I wanted it to be on, so I need to go and try to get it to act right. And then Corey, you said you sent the TikTok, and I'm pretty sure maybe it's loading on the Discord. Maybe it'll come up here in a second. I'm watching it.
One, such as an interproximal sweet spot that we don't want to hit when we're trimming, can be marked when you're practicing, but mentally marked when you're actually in the field. Make sure you check up your margins.
Oh, there it goes.
Practice mark.
What the fuck are you guys doing now? Oh, I guess it'll come to my headset. What the? Why is her? Was she gonna drink? You're gonna throw up. Why is it? Why do you have to scarf down a big ass sandwich and she's gotta just dunk a fry in barbecue sauce once? Oh, she went and hit up a chicken nugget. One of you's gonna throw up. I felt so sick. Oh yeah, he feels so sick. An apple pie. Go back to the drink. I'm gonna choke. I like the theme sort of it. I would say yeah, turn that into a TikTok. That would do good. Oh, it's your freaking shadow. I thought that was a cat. Oh yeah, it's a shadow. I was gonna say you guys didn't know each other beforehand, huh? We did that in the parking lot of Aspen. Yeah, the security footage is gonna be freaking hilarious. That's funny. Run your laps, bitch. Where's the sauce? They're gonna show footage and say some weirdos were in the parking lot, and you're gonna have to act like I don't know you, like you don't know us. Yeah, I have no affiliation with those people in there, but you probably should hire them. That's probably how I'm gonna lead my first foot off of there. That's hilarious.
Marks when you're actually in school, but
Then I'll put in an application.
trim, hike your thumb out, go ahead and place it as a fulcrum.
Okay, I need to throw a sheesh in there. Where's my sound effects? I know I have a sheesh one. Where's my meme sound effects? There's a yeet. I have get wrecked. That won't work here. Suspense. Bass boost. Transition. 20th century records. Sad violin. Meme quotes. Did I put under quotes? Oh, there it is. Okay. Western dental behavior. They'd probably the dig this. It'd be a level above what they're used to having to deal with. Oh, that's loud as sheesh. Alright, let's drop it by 30 decibels.
When you're actually in the field. Make sure you
Okay, that's the one that I want. Very profesh. Let's throw this 5 decibels so I can actually see it on the reading over here. Okay, cool. Okay, I want that part. In, out, and that's it. Very profesh. You should put that on your application. Right? Starter of the TikTok trend, run your laps, bitch, while eating fast food. How long is lecture? When should I show up? With lecture, it's gonna be the same like hour stuff. Usually, I'm gonna probably crack lecture to be done at 8:30. And then I'm just gonna have them start doing their sealant stuff. Another one that's gonna happen is I'm gonna have them do that. What's it called? That 15-minute presentation, where I'm just gonna randomly just pack them into groups. Shoot, I might even just be like, hey, whatever table that you're sitting at, that's your group, and it's gonna be the one that you. Oh, I guess this was your first term. It's gonna be the Yeah, 15 minutes to your group floss, your group toothbrush, your group mouthwash, your group whatever. Find or give me an oral hygiene. Give me an oral health tool alternative, because I think that's what I did last time with you guys. I forgot what groups you guys were in, but back then it was like you 3, you 4. No, it was you 3 because Amaya wasn't in there yet. David and Akina, and I think that was like the whole group. Oh, that was a fun thing. It was with Juke. Yeah, that's what you guys had. It was an unequal thing. I think it was like a group of 3 and then a group of 2 when I had that happen. Yeah, because it was like 5 people in there. We did pairs of 2. Yeah. So that's what we're gonna do tomorrow. I think I'm gonna start off with that. No. I'm gonna finish off the rest of the lecture. I'm gonna skip over this one part, which would have been the oral health tools. You guys did flossing? Trying to remember if you guys did, like, if you were the one of the people that were like, oh yeah, floss with like a carrot or like a celery strand or whatever it was.
Hiker thumb out. Go ahead and place.
Oh, I need to go and make that sheesh a little bit right about there. That's when I want to sheesh this up. Celery, yeah.
Now, go ahead and place it as a fulcrum onto your opposing hand with the crown in it.
And maybe let's drop that 3 minus 3 decibels, so it's a little bit more hidden.
Go ahead and place it as a fulcrum.
Yeah, a little bit less. Throw another 3 on there.
Go ahead and place it as a fulcrum onto your opposing hand with the crown in it and bring it close so that we can safely trim. Being mindful of my pencil or my mental marks, I'm going to go and trim the sides. This is the interproximal area, so going and flipping it from one side to the other to get a decent contour without ruining my contact.
I need to rephrase this one. Let's see. How do I want to say this one? Let me get my microphone's right here. Cool. Will it take it? We should race x-rays. I'm fast. Dog, if we're gonna race x-rays, I'm gonna have to be blindfolded. And I'll do it. I will run circles around you blindfolded, FMX, or just a recall set. We can see. Go for it. I'll win. Challenge accepted. FMX all the way. And that's the thing. I think everyone in the class currently has done x-rays, so they'll know what's up. Not the pinky drink. Wow. Dog. Now crimped. Sir Bite. This is no ordinary pinky technique, right? This is a dental assistant's secret weapon. It's one of the things where in the hands of a normal person, it just looks fancy. But in the hands of a dental assistant, it's one of our most deadliest weapons that we have. Abnormally, we have conditioned ourselves, strengthened ourselves to be able to do abnormal feat strength defying things with just pinky strength. I'm also used to running so people don't get dramatic or gag. Oh, that's true. You would have that happen now. Yeah. See, that's the thing is like it would be nice to be able to do it on like actual like either a better set of like Dexter heads or just people on a real person and see how that all goes. But especially with the dramatic and the gag, yeah. My arm started to get sore the other day from holding that dang HE for so long for a root canal. Oh, because you're holding it like, because you're just holding it like this and you're just like, or are you holding it all weird and just like this and trying to like crack your wrist into it? Oh, this is just a saw blade. For reasons why I don't need to explain, but yeah, I just have to have it near me. at all times. My God, I actually got irritated when a patient complained about the HV and how they're so sensitive. Oh, but they were like, "Oh, it makes my teeth hurt" or something like that.
Trim. Being mindful of my pencil or my mental marks, I'm going to go and trim the sides. This is the interproximal area, so go in and flipping it from one side to the other to get a decent contour without ruining my contact.
Okay.
This is the interproximal. Go and trim the sides.
Okay, let me go and cut this. Oh my God, I actually get so determined and patients come to the tree. I have some stories tomorrow. Super cool. I'm gonna take my mic off real quick. I need to use my mic for my computer because I'm gonna record a voice line, and hopefully I can do it and get it to track. What do you guys hear me through? 1 second. Okay, so it's coming from up there. Okay, so what did I say in this one?
Being mindful of my pencil or my mental marks, I'm going to go and trim the sides. This is the interproximal area, so go in and...
It's so cold, girl, you're 54. Shush. Who's cold? Who said cold?
I'm going to go and trim the sides. This is the interproximal area, so go in and flipping it from one side to the other.
Oh, the HV. Oh, yeah. Oh, I feel you. Yeah, they're such babies when it comes to that.
The sides. I'm going to go and trim the
Okay. So
sides. This is the interproximal area, so go in and flipping it from one side to the other to get a decent contour without ruining my contact.
okay. This is gonna be my thing. Let me go and mute my sound. Oh my God, using desktop YouTube to find emojis is nearly impossible. I was gonna ask playfully. Oh, so you're done with a lot of your pinky? Yeah, you done. And that is a certain emoji, but I couldn't find it. Why does nobody understand how a saliva ejector works? Whatever moments pass. I feel you, Crip. Definitely, I feel you. I gotta bring it up before I go into that next one. One of my favorite ones that me and my wife will laugh over is an American Dad joke. American Dad, he's... So with this American Dad joke that me and my wife send to each other quite frequently, because we're freaking... We have like the worst humor, is one that's this, and it's American Dad one, and it's with Francine and Haley, and me and my wife laugh every single freaking time.
Haley, I think we need to have a little mother-daughter talk.
Okay.
Your husband's condition is way out of control. Bottom line, you need to start satisfying him more, sweetie.
But Mom, I satisfy him all the time.
Well, then you gotta do it better. Get creative, Haley. Use your pinky.
I'm using my pinky, Mom.
I don't think you're using your pinky.
I told you, I'm using it.
But are you really using your pinky? I don't think so. Get up in there.
It's terrible. Every time we want to try to scare each other, we'll always just send that stupid clip. And especially, like I always say with the dental assistant and the pinky jokes and everything, which I do want to make a funny skit about dental assistant's pinky stuff and everything. but that'll be for a future time whenever I actually want to put in effort for it. Okay. Let me see. Oh, I was super low on that one. Okay. Let me get this recorded real quick. You guys will see it live. Okay, I was talking about
being mindful of my pencil or my mental marks. I'm going to go and trim these sides. This the marks. I'm going to go and marks.
Okay, so let's run that. Audio. Oh, I had a crank. Sorry about that. But it is going to be louder, a little bit more louder than it usually is right now. So I'm going to go and pull this down a slight bit as I ADR this real quick. Hello. Okay.
Or my mental marks. I'm going to go and trim these sides. This is the interproximal area. So.
Okay. So let me see if I can hit this.
Being mindful of my pencil or my mental marks, I'm going to go trimming the sides, making sure that I do not hit any of my pencil marks.
But even if I flip it over, going to
get a
make sure
decent
that my contouring
out
is really tight. Nope, I don't want to use that one. I want to cut out a little bit of that. And that. But I don't need this part. I'll probably clip out another one that we have here in a second. Okay.
Trimming the sides, making sure that I do not hit any of my pencil marks. But even if I flip it over, I'm going to make sure that my contouring is real.
Okay, I'm gonna kick it off at contouring.
And if I flip it over, I'm going to make sure. And if I flip it over,
flip it over.
Going to make sure that my contouring is really tight, or getting a floss to snap.
Or getting my floss to snap. That's something else I need to be paying attention to. That's going to come up.
Or getting a floss to snap. Slowing down the camera.
Or getting my floss to snap.
Flip it over. I'm going to make sure that my contouring
I'm gonna make sure
is really tight, or getting a floss to snap.
Okay, so I can crank this out.
Slowing down the camera a little bit, you can.
Okay, let's go and I'll cut this out so I don't have to worry about specifically relating to that.
Any of my pencil marks. But even if I flip it over, any of my pencil marks. But even if I flip it over,
even flipping it over, I'm making sure that I do not hit my contacts so that my floss can still snap.
Slowing down the camera.
Okay, we can go and see this.
But even if I flip it over, even flipping it over.
Okay, I can go and dig that back a little bit.
But even if I flip it over, even flipping it over. I'm making sure that I do not hit my contacts so that my floss can still snap.
I'll bring that down. Bring that a little bit more in.
It can still snap.
I'm already gonna do some more trimming ones, so I can go and pull this back over here, and
Can still snap. Slowing down the camera a little bit, you can see my angle of my burr as I go and trim the sides, but I hover over where the actual marks are. This may take a little bit to get the contouring right, or even just feeling comfortable with using the handpiece, but with enough practice, you'll be good. And even when I would go into other places like the marginal line, I take care to not mistakenly hit that contact spot. Without proper contouring, you can see in certain cases when the patient would floss.
okay, I need to text that as ledge. Why is that not? That should be the same. Yeah. Okay. So let's duplicate it. Bring it over. Crunch it down. Not that far down. Crunch it down. Back over here. Double click. Double click. You son of a gun. Okay, why aren't you letting me do it? Oh, because it's already that. Okay. Floss, flash, flashing, floss, ledge. Okay.
Without proper contouring, you can see in certain cases when the patient with floss, they can actually pull off their crown, and that is an issue. Same thing with posterior teeth. Firm grips and fast speed you get to go and smooth out on the face. You can see this at a different angle as I go into the same type of adjustments. Your grip or tool may differ, but in the end, you hope for a good one. Throughout this time after trimming, you want to go and lick it, stick it in there so that we can go and check it and see if there's anything going on. Such as checking the bite. Like this articulating paper that I'm using to go and bite down to see if anything runs. I'm going to go and make sure that I don't have too high of an occlusion that will potentially knock the crown off or give any discomfort to the patient throughout their time under the scrub. Another important piece to check is the floss, making sure that when your patient is actually flossing, making sure that it doesn't get caught.
Nope. That is too overstepping of itself.
Another important piece to check is the floss, making sure that when the patient is actually flossing, making sure that
Making sure.
another important piece to check is the floss, making sure that when the patient is actually flossing, making sure that it doesn't get caught on any that it doesn't get patient is actually flossing, making sure that
That. Okay, let's kill that. Bring that over a little bit.
patient is actually flossing, that it doesn't get caught.
Okay, I do like that. Sure. No snap. Bring that out one hit. Okay. Bring that over. Snap. Back into reality. Oop, there goes gravity. Okay.
Patient is actually flossing, that it doesn't get
I'm gonna go one stitch over.
is actually flossing, that it doesn't get caught on any ledge that may be behind.
And then let's bring the sound bite on that specific floss one down like 8 decibels. It's not super loud.
Flossing, so that it doesn't get caught on any ledge that may
Let's bring them all down 8 decibels then.
get caught on any ledge that may be behind by the trimmers. And now that that marvelous mouth has a tantalizing tent in there, we're going to make sure a couple of such as margins, making sure that those ledges are smooth in transition, and that there's also no bulky buckles on the crown. Let's go ahead and finish this up by cementing this stuff, either using average strength or tough stuff. Your situation may differ depending on the crown and the prep that you have. With this average stuff, dispensing equal amounts of paste and getting my mix on so I can get a good single.
That went up a little bit higher than it needs to be. So let's bring that down like 2 decibels.
Average stuff, dispensing equal amounts of paste and getting my mix on so I can get a good
That's
single
good.
homogeneous color at the end. With that all mixed together, go ahead and scrape up your full load and shoot it right into your crown hole, or use an available instrument that you have to go ahead and just apply a line. Now, the main thing is to stick our landing and pop that crown on. With a little pressure, or even a cotton roll and patient's biting pressure, we can be sure that it is fully seated and all the material is different. Now, with your choice of instrument, whether it be an Explorer or your cord packing instrument or plastic as we know it, you can go and make the choice of removing the excess cement after it is finished. If you let it sit long enough, it should be able to harden and come off in nice smooth blobs without swirling. to. Using our special floss technique, Jutsu of tying a knot in it, you can go and take that in while holding the crown down. You're going to go and pull the knot through, knocking out anything that was in between the teeth. Take this as an opportunity to teach your patients how to floss with a temporary crown so they don't accidentally go and knock it off or pull it off in their invention. As you can see from mesial distal, there's tons of stuff to get out of there. There's just only a thin layer of cement down in the crown. But move it on. If you get yourself in the bind,
I want to recreate this reline one. I might do this tomorrow and do a different footage for this. Let me go and it's not the whole thing either. I just want to do it for these two pieces. So let me go and label them mango. Yeah, mango would be fine. And then I don't need my paint application over anymore. Oh, and then I need to do a sign off, or I need to do something at the end here.
or those instructions, such as when you floss up, and then pull out, or else when you're
I should do a fourth one that refers to anything abnormal to call, but I can also just say put it in here under falls off, or breaks. But it's mainly when it pertains to the crown.
takes us to the point, or those instructions, such as when you floss up, and then
Well, if that's going to be the only instructions, then let me go and drop this down. Nope. I just want to drop this down. Maybe pull it back in size. Oh, I don't really like that. Post-op instructions. There.
place it onto the tooth, let it set, and trim it. That takes us to the point where the first instructions such as when you floss, and then pull out, or else. When you're eating, don't eat anything sticky, or else. Usually the final thing that happens is, if you do any of those, if it falls off or breaks, call us, or else. I would hate to see that you go out there, have your crown fall off, and just throw it away to the trash can, because we could have reused that crown, re-cemented it, and then left it there until your permanent crown comes in. So, don't do anything crazy like that, or else.
I need to do a sign-off piece for this. I could do a sign-off tomorrow. I can record it tomorrow. I need to record a filler part right here.
In this example, we're going to be using tooth number 8, but the same rules apply to all different types of single units or bridge acrylic crowns.
I'll probably take out that part. I don't need that audio.
Temporary crown for your patient. In this example, we're going to be using tooth number 8, but the same rules apply to all different types of single units or bridge acrylic crowns. So, talking about temporary crown,
Okay, I want that to be more of a less dead noise there. Bring that over. That should start a little bit quicker. Okay.
single units or bridge acrylic crown. So, talking about
And maybe I'll just, okay, let me unlink. Let's pull this back.
apply to all different types of single units or bridge acrylic crown. So, talking about temporary crown, all just
Well, I forgot to ask you if you'd given any further thought to the character thing that we spoke about last night. If not, that's completely fine, but I figured I'd ask. Yeah, I haven't really given too much thought to it. And it's mainly because, like I was kind of talking about last night and everything, it was, I really don't know, like, what inspiration I would kind of draw from. I guess to what I would look to trying to make a kind of character of anything like that, I guess I would look into what traits I would have them kind of exude. So like like if I was to go and like watch a lot of animes or whatever, it'd be like, oh, I kind of feel a lot more related to like this type of character because they are the blank character, and I'm like, oh, that's the ones I usually dig is these types, and then I would just kind of amalgamate and just pick different pieces um, of their of their gear that they would have or their looks that they would use and go from there. So, which kind of would be not too hard to do. Let's see. The way I came up with a lot of mine was essentially an idealized version of myself, but also implemented my interests that would incorporate into the design. The only thing that I can kind of relate to as far as like currently what would I like to see myself as a design would just be it would literally just be like the father character, like it would just pretty much just be like the father character of like any situation, or even personality. That's also cool, right? Or personal history. Yeah, yeah. Like all I can think about now is like all that stuff that like kind of like made me be who I was, which essentially was just being a support. I was always everyone's support in whatever, and so that's kind of when I had kids. It was more like, oh, I'm their support, and it's not like and it's different because I'm their lifetime bottom lane support role, as a like a League of Legends reference and everything. Um, so I always kind of just thought of that as just be, especially since I can probably guess that my kids are going to be not fairly short but shorter than me. That I'm just, hey, it's big pa, it's pa. So that's kind of why I kind of reference or think of it as myself as just it's just like a dad character. That's all I can think about of it being now, and I like it. I tend to. I think that's kind of matches what I got going on now. Back then, especially like back then, I would probably kind of go in a way of doing like some type of technology based, uh, like a tech nerd. That's what I would have gone into thinking like that would be my like aesthetic that I would want to take on is just, oh, this person that just has technology all around them, super into doing that. It almost like I guess how I'd look at it as would be like Sid from any of the freaking Final Fantasy games, because Sid always takes on a role of there's always a guy, there's always someone named Sid, and he's always usually repairing stuff or trying to fix something, but he's also kind of the technology based person of it all. So that's how I always saw as that's the type of style that I liked. I get that mindset. I realize that it's also hard to fully come up with a design from scratch. I looked at a lot of things before I even had an idea of what I wanted to do. Yeah, yeah, yeah. For even at the furry community, because they have a lot of neat concepts. They do have a lot of neat concepts. Like people give them heck about like their stuff that they do and everything like that, but they are creative, and I'll give them that. Absolutely, it's just amazing that what they're able to either accomplish just creatively, accomplish from a building standpoint, and what they're actually able to make, and how it can function, making these mechanical, just these oversized mechanical costumes that can fully articulate movement and jaw hinges and all that stuff is very, very cool. Yeah, definitely they get props for that.
So, talking about temporary crown, that all just depends on who's able to do it. And starting
I'm almost done with this. I'm
from the top
almost
closest,
done with this video. I want to finish it by tomorrow. I need to record an outro. I need to fix a little intro. I just need to put something a little bit more on the intro to juice it up. Finally, I get this one finished. Dental temporary crowns. Oh no, I was gonna say I should have made a reference to chiclet stuff. I should. I won't do it right now, but I should still try to reference ugly temps. Even yeah, I should be able to do that, and I'll put in something at the end about don't make temps super look nice because then the patient won't come back and actually get the real temp. So I don't want to do this one because that looks too much like a real crown, and we're not making them real crowns. Oh, I can recognize polycarbonates. I'll do polycarbonates in another video where I talk about snap. Which actually the snap one will be pretty easy. I can almost just copy paste. I could almost do it in the same way that I did my other one for fixing the air water syringes, because I use the same intro. I just changed the thumbnail, and just very few little things in the in-betweens would change. But with the snap product, it's pretty simple. And when I do snap, I can do the polycarbonate crowns too. That's actually not bad. What do you say? Let's see. Even as I personally enjoy the tech furries, protogen specifically. Oh, cool. But when put into real life, because they also involves wiring. That is true. They are very tech savvy among those pieces, especially using our Arduinos and everything to be able to have that control. And even some of them change their faces and the visor depending on how they move. Yeah. That's just amazing for some reason. Anyway, moving on. I can rant forever on this, but I get what you mean about getting that father figure character. Yeah, I'll have to come up with something. You know what I'll do in a way is I'll ask my two sisters, and I'd be like, hey, do something when they have time. Be like, hey, give me like a rough concept thing about what you guys think that I would like to look like, or what you think my like OC would look like, and then usually at that point I'll just be like, yeah, that looks cool. That's actually something I'm totally going to make my personality for the rest of this time. And so usually I'm not too much of a stickler on a lot of things. I am not finding a temporary crown that I would like. Oh, I guess that picture's not the best. I'll take it. Maybe I'll use this. Do you have a favorite genre of movie by chance? Genres for movies. What do I like? Scary movies are chill, but I'm probably not going to be able to watch them as often as I used to until the kids get to the age where they can like understand that this is cool, even though they like pretty weird stuff and everything, like Five Nights at Freddy's and Poppy's Playtime and everything like that. What genre? What movies do I watch? What do I even do anymore? What's the last movie that we watched? It was something recently. We were like, oh, they finally put this on Netflix or something, and then we all got psyched, and then we came out here, and me and my wife watched it, and it was an alright movie. I think it was Miraculous Ladybug. We were like, because we got into it because my daughter was into it, and which one was into it? My oldest got into it, and then my youngest got into it, and I was just like, oh, cool. And then we did a Ladybug Party, but that wasn't the most recent one. What was it? An alright movie. What about good movies? One do you hold up to a high degree? Like something that I could go back to. And this is one of those things. Like I know a lot. I know quite a few people that are like, they're not movie snobs, but they go for like, they're like, oh, I'll watch any Quentin Tarantino film, or I specifically like Eli Roth or whatever. I have no freaking clue, like actor names, director names. Even a lot of times, I'll just like songs and not know who the hell sings them. I'm just terrible at. I'm terrible at the recognition of the artist, but I'll like the art and everything. What movie would be a good one that where I would be like, yeah, I can go back to that. I think a lot of it's just gonna play into nostalgia and be like, I watched this to hell and back, and I still like that one today. Like right now, like all I can think about is like Austin Powers, which like I watched it recently. I have it on my setup so I can watch any of the three movies, and I was like, this is funny. I like this. This was a pretty good. This is yeah, Austin Powers, mainly 2 and 3, The Spy Who Shagged Me and Goldmember. 1 is funny too, but yeah, the Austin Powers series is fun for me. But that's just a comedy thing. Like I don't like rom coms. Don't really like romantic movies too much. What else did you put in there? Asking these questions for a reason. Don't worry, no, you're good. Director names are null and void for me too. Yeah, I figured on that one. Yeah, I mean, I think I would just go into like comedies then. Comedies would just be like the way that I would go in. The way I would go on any of them. It's like I can deal with that. And there's like things like where like I like Adam Sandler as like an actor in some movies, but if you were to throw on like a deluge, just like a movie one after another of just Adam Sandler, I can only handle it for like a little bit. So that's where I can't have too much of him. Mike Myers, I can deal with him and a lot of his stuff for a good while, but then there'll be just some that I can't handle. Yeah, I think comedies. Yeah, I think comedies. Especially coming into my dad mode, it's like I have all of these jokes at my disposal, and I'm just going to let them loose on my kids, on my students, just relentlessly. Very referential. None of the jokes are gonna stick and land or at all. It's just it's fun. Let's see. What would be a good one? I would think that an animated movie that would be good, like cartoons. We talked about. Okay, I'm gonna be honest. I didn't expect you to go Austin Powers as a go-to. I know that's the thing. Hello, I'm gonna go with Sharon. Nice to have a new person show up and everything. I know we're in weird conversations. I have video editing going on over here too, but if you have any dental questions or anything like that, I can always try to help out with an answer. But nice to see you here. Let's see. I know, yeah, it was weird as an Austin Powers as like a go-to one. I think I'm just playing off of like me being like 13 and like those being like the haha movies of my younger teenage years and everything. What if you implemented elements of those movies to enjoy to the design, maybe small versions? Oh yeah, that would be a thing that would probably be good on that end too. Hmm. That is a good um, that is a good reference. Oh, cool. We have an actual dental question. Cool. Is it painful in local anesthesia? So there's a couple things. Good that you asked that question. There's a couple things that can make getting the injection, getting the shot, a little less painful. Now, it really depends on the dentist that is going to give you the shot. They have a couple ways of making it not as painful. Usually it's going to be this jelly that they're going to go and the assistant or the doctor will rub on the gums. And if they leave it on there for 1 minute, then if they leave it on there for 1 minute, it should, it should take away a lot of the pain, but you'll still feel that small little sting. And, and that can happen. Another thing that can make it hard is when let's say as an example you have a tooth that's really painful. Because it's already painful, the gums, the tissue around there is going to make the pain of the shot a little bit more painful too. So you kind of just have to get used to it for just a moment, and then it'll be over soon. Now, I mean, is it painful if we did it with DentaPen or painless inject? If we did it with a DentaPen, hold on, let me get that specific. Is it painful if we did it with DentaPen or painless injection? Let me go and do a little digging real quick. Painless anesthesia. Okay, let me go and look. Let me go and see what their version of it, because I'm pretty sure when it comes to this, it's going to be something that I've looked into. Is this one of the things that just uses vibration? Most enthusiastic about it, dense pens which low pain administration. Is this just using vibration to throw it off? I have a feeling that's all it's doing. Reso discovered the electronic syringe. DentaPen is a feature of anesthesia, a highly ergonomic device designed to provide a pain-free dentistry. So it looks like, okay, so it might use vibrations, probably a little bit. It looks like it probably administers it. So instead of us having like the actual squeeze technique of injecting the anesthesia, it automatically pushes the anesthesia in, which is important. Kind of like you mentioned, kind of one of the factors I was going to go into is that if the doctor does it really slow, it doesn't have to be that painful. It doesn't have it will reduce how painful it is, because some doctors are just going to be like poke, pff, just push it all in, and then they're done. They're going to a different room to handle another patient while you get numb, and that hurts. We don't like that. But in this situation, it looks like they're at least getting the needle in. They're hitting power or whatever they need to do. Maybe they just put a little bit of pressure, and that's an activator to have it slowly dispense into the tissue, and that's good. That's how it should go. When the injections go in, it should take 30 seconds to 1 minute for the anesthesia to fully go into your patient's tissues, into the gums and everything, and that will help a lot. Other things that can help is a jiggling technique. So when the needle is inside of the gums, the tissues, your doctor just gently shaking the cheek is really nice, because that's going to send a signal to your brain that it needs to pay attention to the shaking. And when your brain is paying attention to the shaking, it's not paying attention to the shot as much. So that's one way to make it so that it's less painful, and and it helps because that shaking is massaging the liquid, so it doesn't stay as a big ball right where the injection is. It kind of moves and smooths to all the tissues when that happens. Another way to help make it a little less painless is that cartridge, the carpule, the medicine that we would put inside the injection. If we warm it up, it's really good. So usually your assistant, if they're preparing for it, or your doctor, if they just hold it in the palm of their hand and let the heat from their hand warm up the carpule before they put it in and inject, that makes it so it's not such a shock that it's cold going into your warm body. It makes it so that it's slightly warm going into your warm body, and it won't hurt as much too. Tomorrow's my premolar extraction. I'm so scared. Is it also painful? So premolar extraction, you're using pretty good words on there too. So tomorrow's my premolar extraction. Usually a good thing, something to think about is when they do premolars, sometimes they have to be extracted because maybe they're broken, maybe they can't be saved anymore. But kind of a shot in the dark. Are you getting your premolars taken out for braces? I know it might be asking too much, but a lot of times when we take premolars out, at least one per quadrant, it's because we're trying to make room for us to shift teeth, to make room for to have braces pull or push teeth where they need to be. Premolars are a little bit more in the front. If you're doing a bottom tooth, yes, it is. Hey, look at me. I'm pretty good, aren't I? So that's good. Sometimes what we call those ortho extractions, depending on your age, can be really simple and really easy. And if they're doing ortho or braces extraction for braces, they're going to take one from both from the lowers or two from the uppers, or they'll do four and just do 1, 2, 3, 4, and you're good. Me, as an example, when I had braces, I had my two lowers taken out, my two uppers, my two premolars on the top, they got to stay. I had enough room. But if you are going to get lowers, if you are going to get a lower premolars taken out, they're going to give you a shot in the back corner of your mouth. You'll just have to get through it. Usually they'll do good, but depending on your age, like a lot of times when the patient's like 14 to 20 years old, those premolars pop out super quick. So as long as you're numb, you won't feel pain. You'll still feel pressure though. Just the movement, just the feeling of someone pushing you and tugging at you, that's normal. But sharp pain is different. If there's sharp pain, raise your hand on the correct side, which is where the dental assistant is. Raise your hand. I can still feel it. They might say, "Are you feeling pressure or pain?" And you just tell them, "I feel a sharp pain." They'll give you a little bit more. I am 15. Hey, there we go. So it is safe. And they're only extracting three premolars. Okay, so not bad. It comes out super quick. In times that I've assisted for braces extractions, like these ortho extractions, what we call them, usually it'll just be a quick numb. Let's say that you have 3, and when doc comes in, they're going to test all 3 of them and say, "Hey, do you feel this?" They'll use a sharp instrument that's going to poke at your gums, and if you don't feel it when they poke at you, then that's good. That gives them the thumbs up to, okay, let's go pull them out. Literally, once you're fully numbed and the doctor is ready to go, it'll probably only take like 1 minute to get all of them out. If the doctor's really quick, it'll take like 1 minute to get them all out. If they're just trying to take their time, maybe they'll all be out in like 3 or 5 minutes. But they're with your age, with how soft your bone is still, they're gonna be super quick. And then just follow their instructions. Follow their instructions that the dental assistant or the dentist will give you after. They're going to tell you bite down on these little 2x2 gauzes, these little cottons. Those tell you how to fold it up, put it on the hole, bite down, hold it there until you don't bleed. That's cool. And then when you stop bleeding, everything will be normal. You can take them off. Don't drink through a straw. Don't smoke. You're 15. Don't smoke. Don't spit too hard. Don't try to rinse it out really hard, because you want the blood that's going to be in that socket to stay and create a blood clot. Kind of like I cut myself recently. Kind of like how I have a little scab right here. You want you want those holes to get a scab in there so that they're closed. And that's going to be important so that you don't get something that's called dry socket. So as long as you don't, you'll be fine. Follow the instructions and everything. It's the third time I'm going, because last 2 times I refused them to do because I was scared of the injection. I totally feel you. And you know what? Even me, I've been doing this for 15 years. When it's my turn to get into the chair, my heart is racing. I get scared too, and it's totally normal. Some things that make it a little bit nicer, if you're able to, get some headphones. Like I've had these on, and these go to the side of my head specifically. But if you can listen to music, that will help a lot. Keep your eyes closed. When it comes to the needle and the injection and everything, just have your eyes closed a little bit more often. Ask your assistant. Be like, hey, do you have numbing gel? Can you put that numbing gel on me a little bit earlier so I'm a little bit more prepared? That can help you, so that not only that you don't feel it as much, but they hopefully will work with you to make it a little bit easier. Same thing for me when I go into the doctor's office. I'm 20 now, and it still scares the mess out of me. Yeah, it never left me to be nervous. And it's just something that happens. It's just something that has to happen. Sharon and let's see. Yes, they gave me that spray. They gave me a spray that numbs. That numbing spray is awesome stuff. If you want to go and have it with you, and maybe when you get into the chair, just give yourself a little spritz. Give yourself a little spritz where they're going to do some of the injection sites. Let me bring it up actually. So, dental injection sites. I also have a video about injections too that you can look up. These don't look as nice, but definitely there's something. Yeah, I won't bring this up. But yeah, use that numbing spray. That can help. That can help a lot, and just kind of get yourself pre-numbed. Just when you get to the chair, ask the assistant, "Hey, is the doctor going to be with me? Going to be in here in the next 5 minutes?" They say yes. Okay, spray yourself up. The numbing will start working by 1 minute, and it'll be the highest it can be by about 3 minutes, and then it'll start wearing off by 10 minutes. After the numbing spray, do we feel the pain or piercing? You could. I'm not going to say you're not going to, but I'm going to say there is potential that you could feel a little bit of a sharp pain. It's normal. Like I mentioned before, concentrate on something else. Ask them if they can, ask the doctor, can they wiggle your cheek while they give the injection? Remember, like I said earlier, that wiggle is going to tell your brain to focus on the wiggle, not the shot. So that can help a little bit. Even some people that I know will pinch themselves somewhere else and give themselves pain here so that they don't feel it here. Whatever distraction that you can do to yourself can help get through there. But you'll more than likely do good. Something that I'm kind of thinking about too is good. They gave you the spray, awesome stuff. Another thing that can be useful too, if they have it, you're 15. They may not, but something that they usually do for the younger ages, and not every office has it, is called nitrous oxide, which is called laughing gas. A lot of people call it giggle gas, laughing gas, whatever. That can help. That can help. That can help take your fear away of whatever's gonna happen. The only thing that sucks about nitrous oxide, laughing gas, is sometimes they have a fee, a charge, an extra charge on there, depending on where you live and what country you're from. So that's where, like here in America, a lot of offices, if you're above the age of 12, they're going to put an extra charge for that laughing gas. But sometimes you have to just ease into shots being normal for you. So my doctor lied to me and said you will not feel pain when piercing the feel pain while piercing the injection. And see, this is exactly why I mentioned that you might not. I've worked with dentists that were good at not distracting the patient, but distracting the patient's brain to not realizing that the shot happened. So it just depends on the doctor. That doctor may have all these nice techniques and this DentaPen and warming of the carpule, using everything that he knows, using everything that doctor knows to make it not hurt, could make it so that you don't have any. That could make it so that you don't feel it at all. And like I mentioned before, it's kind of like it's like a little pinch. Just if you were to pinch your arm, that's what you would feel, but just at a small part of your mouth. And something also also something to keep in mind. Injections in certain areas of the mouth are way easy. Oh. I'm back. Don't worry. So, like I was saying, injections at certain parts of your mouth hurt a little bit more than others. So, if you have, say, you're getting the top teeth, you're getting an injection in the top teeth, those usually tend to be good. If you're getting an injection for the bottom teeth, that usually happens in the back corner of your mouth. Those ones are not too bad, also. Sometimes when there's an injection sometimes when we get our teeth extracted, we need to do something that's called a palatal shot, where essentially you just get a small little shot right there on the roof of your mouth. So if you want to prepare for it, it's as if if you were to bite down on a chip and that chip just jabs the roof of your mouth. That's what it feels like. It's not too bad, but it just feels a little uncomfortable. And it doesn't go deep at all, because there's about that much room of your hard palate that's there. So it's not like it's piercing through a lot of muscles or anything. It's very surface level. Go in a little bit, the medicine goes and travels, and it goes everywhere, and you're fine. I had an impacted canine, and when they injected, I don't remember pain because I was screaming and crying. I feel you. It is tough. Yes, sometimes when you have canines, which good on you knowing all this dental terminology, all these tooth names and everything. But yeah, when you have impacted canines and everything, they'll do a procedure called a canine exposure, where they'll give you that same injection, one on the hard palate, right? And they'll create a window. We'll say it like that. They create a window, put a bracket on that canine, put a gold chain on there, and they'll attach that gold chain to something else so that it can slowly pull its way out, and it goes from there. and those are cool. They take a long time for them to fully get finished and everything, usually like about a year. We studied the names of teeth in 6th grade. That's super cool. I like that they brought up dental stuff, or I should say dental things, the channel, right? I'm glad that they brought up dental things in school as far as like the actual names, because for one, something you might not know, I'm a teacher for dental things. I teach dental assistants how to do what we do, and all the terminology, all the numbers and everything. And when they come in, they know molars, and maybe they know premolars, but they don't know any of the front teeth except for canines. Had to look up that terminology, to be honest. I'm still hella ignorant. You're all good. But yeah, that's super cool. That's super cool that you guys you have that under your things. Also dental things, but that's what I specifically made this channel name, because it used to be my this channel name used to be my old nickname, but then I changed it to dental things to kind of match another channel that I watch, and I was like, oh, I kind of like the idea of that channel name. I'm gonna make that a version of mine, and then make that work. And I really liked it. I really stuck with that. I'm scared for tooth extractions, but also at the same time I'm excited for getting ice cream. The ice cream part is super fun. The ice cream part, if you can kind of think of it like that, as I will get something really good. I'm gonna get something that I really like after this. It can be a super big help. So you are not what's it called? You'll be fine. You'll do good. And also, more than likely, I'm going to be live, kind of like this tomorrow. When try it, do your best to get it done. Like you mentioned, you're going to get it done tomorrow. Come back and tell me about it. In tomorrow's live stream that I'm going to be doing, probably this stuff and everything. Tell me how it went. I would love to be able to kind of walk you through it, have you tell me what they did, how you got through them, how good that dentist is, or how bad they are, but you still got it done. Love to hear this stuff. Confirmed stream for tomorrow. Crypt, yeah. And you did remind me. I think I'm gonna order this. Dock on Amazon, and I think it'll show up tomorrow if I order it today. Same day, free tomorrow, delivered by 5 p.m. Yeah, this will be delivered. All right, I need to transfer over some money. Let's see, I'm gonna save that for later. Save that for later. Save that for later. Save. What the hell is this? Oh, save. Save. Okay. $30, yeah. Yeah, so I can actually go back and like play games and everything, even though this is good for me actually getting videos made and everything. I'm home and I'm very brave and ready for extraction when I'm ready for a hospital. And when I reached my hospital, my fear anxiety woke up. Yes, that is a big thing. It sucks to be in hospitals, at dental offices. It just all comes back to you. Distract yourself. You might have a phone that you can use. If you have headphones, that makes it a little bit easier too. If you have like something to like squeeze, like a lot of times like a stress ball, or like something that you can fidget with. A lot of fidgeting things that we have. You can spin something that'll help you. That'll work out really good too. Just find a way to distract yourself where that time's coming. They turned on that suction. They have it in your mouth. You know what's coming next. But all I'm concentrating on is that I'm spinning this fidget spinner, or I'm rolling dice in my hand, or I have this clicky thing, or a pen, and I'm just gonna keep on clicking it. And just try to focus on that, because the injection, the shot, from when it starts to where it ends is like 15 seconds. Once they get in there, they'll do their injection, they get out. And after that first injection in that area, all that gum around it starts becoming numb. So even if they did a second one, you're not even going to feel the second one. And then later, if you end up feeling a little bit of sharp pain, if they were to give you another injection, that tissue is already numbed, so you're not going to really feel that as much either. You shouldn't. I try to distract myself with music, but the super brain always thinks about the procedure. Yeah, that is a rough one. That one's a hard one to get past, which means you have a really good sense of focus, even though like you might think of it as a bad thing. It's not. You're able to hyper focus on something and the whole procedure. Realize that that's a talent. You can use that towards something as you go on further, towards your career later on, whatever you choose to do. Think of it as a skill, and even though the skill that you have might flood your brain with what's going to happen next, you'll learn how to turn it into a good thing later on. That's way too real. That's how I feel about doing anything. Whenever I think about doing something in public, I'm so ready. Then I get nervous wreck. I'm working. Yeah, it's kind of like when you're going on like job interviews. It's like I'm ready for it. I want to do it. But then once you're sitting in that chair and you're waiting for someone to call you back, it's like butterflies everywhere. I try to distract myself. Yeah, that's right. How many times it takes to extract my premolar? Yeah, because you mentioned before that you tried twice before, and now it's the third time. You'll get it done. You'll get it done. The sad thing, let's not say sad. The nice thing about this, even though it might be an annoyance for the dentist, maybe your parents, that it's not getting done yet, thankfully, the teeth that they're trying to pull out are not abscessed. They're not infected. They don't have a lot of tooth decay or cavities or anything like that. The only thing that we're trying to get them out for is so that we can put braces on and straighten the other teeth. So, thankfully, it's something that can eventually get done. It just sucks that it's not getting done sooner. So it's just pushing out the time that you'd have to be in braces a little bit longer and everything. But if it was something like, oh, there was an abscess, there was an infection, definitely, I would say, bite your teeth together and just get through with it. But that would be a different conversation that I'd want to have. How much time does it take? Also, for general words of encouragement, you got this. Yeah, we got you. Just like I mentioned, any of my normal people that are here inside, like chat, I guess chat's down there for you guys. This community, they're all good people. We're gonna cheer you on. Tomorrow, when I'm working and thinking about, and teaching my students about teeth, I'm gonna be like, you got this. You got this, Sharon. You got this, Hestia. And hoping for the next time that I'm here that you can come back and say, I did it. We're moving on. We're moving on to the next treatment. How much time does it take? Like I mentioned, once you're numb, the whole procedure is going to take once you're numb and they come back and they get started, you're going to probably be out of that office in 15 minutes. Can you please say that which part of this procedure of the extraction is painful? Say what? Which part is painful? When they're wiggling your teeth to take it out, that's not going to be painful. That's just going to feel like pressure, like I mentioned before. Quite literally, the only painful part that you're going to probably feel a little bit, if at all, unless the doctor's really good, it's just going to be the shot. And that's not going to be as bad. It's not going to be as bad as I hope you think it is. As long as you're able to distract yourself. when you're laying down in the chair and everything like that, and doctors on one side, the assistants on the other side, and they have you open and they're going to do the shot. Lift one of your legs up a little bit lift one of your legs up so that you're paying attention to that leg being up, and start wiggling like your foot, making a circle with your foot. That's another distraction technique that I would tell my patients too. Concentrate on making a circle with your left foot while we're doing this. And sometimes, if they were able to do it, that can distract their brain from feeling it. But yeah, usually the most painful part will just be the beginning. Give that like 15 minutes after you get the numbing done. You won't feel it. You won't feel a pain. You'll feel a pressure, and then you'll be out. I can say probably the next painful part after that is when the numbing goes away, and you just feel sore. So they'll give you medication for that to help out, but it should be fine. When you have to get the shot, just make sure to breathe steadily. Yeah, breathe. Big thing is to breathe. Don't tense up. Another thing. Don't clench. Don't clench. Don't try to bite down or anything, because when you do that, your muscles are really when they're relaxed, they're all spread apart and they're fine. Because so when the injection goes through, it can go through some of these and not have to pierce any of them, not have to go through as many. But when you tense up really hard, that's when now it needs to go through every single one of them, and they're a little bit more harder to go through. That can make it a little bit more painful. So that comes back to the relax, breathe, all that fun stuff. Why when I cry that blood is coming out so fast? Why when I cry that blood is coming out so fast? And when it comes to that part, if you are scared, the dental people know. They're used to it. They should know how to handle that situation, but they're gonna take care of you. They're gonna take care of you as best as we can. As best as they can, I should say. Not we. I'm not gonna be there, but you'll do just fine. It is 12:40 over in my land and everything, right? Yes, we'll be there in spirit, right? But it is 12:40 over where I'm at, and I do have work in the morning. I'm gonna let you guys go. You got this, Sharon. You got this. I want to hear back from you in a future video on how you did. Can you give me any tips or techniques? Like my other chat person said, breathe. Like I mentioned, lift up your leg, distract yourself. That's a big one. Or just find something that you can click. That'd be fine. They're gonna have handles on the side of the chair. Grip those really good. Just grip them and just hold tight. You can whine if you want, and just have your mouth open for the injection. But once you get through one of them, you're gonna be a pro at the end of it, and you're going to be fine. You'll be like, oh, that's not that bad. I can handle the rest of them. Oh, but I am gonna let you guys go for now. I gotta get some sleep. But you got this. Thank you. Oh yeah, no problem. Have a good one. You too, bye and everything. I'll see you guys on another day.